Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMCTV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Kristen Martin, and she is a board certified in family practice, addiction medicine, and has worked as an emergency medicine physician and a medical director for over 15 years, and is CEO and owner of River Valley Medical Wellness. Dr. Martin, thank you for being here.
Thank you, Robin.
So you have some exciting new things happening. Tell us about your new project, the new mobile unit.
Thank you for allowing us to sit and talk about today. It is really exciting. We have a new nonprofit arm of our organization in response to the opioid crisis and need for patients and communities in Arkansas. It's known as ARMOR, which is Arkansas Mobile Opioid Recovery. It is a nonprofit organization where we're going out into our rural communities and helping to serve both the rural and vulnerable populations that simply can't reach some of the medical services, particularly addiction medicine and substance use services that are needed to help fight the problems that we have facing our state and nation.
And so it is primarily focused on opioid services, but not necessarily just that.
Correct. So the funding initially is coming for the opioid crisis. We are losing 1 to 2 Arkansans a day to opioid overdose. And so because of the high death rate and all of the other issues that happen with opioid addiction, really our focus has been to try to reach out to these communities and to provide that service. We take a little bit different approach to that model by doing an integrated healthcare model where we offer primary care, mental health, and addiction medicine to help those people who are suffering from addiction be able to get comprehensive and well-rounded services. We know that when we do this, that they have better outcomes and better chances in the long run.
So is it you working the truck? Is it multiple healthcare providers? What does your staff look like?
So I'm glad you asked. So there are so many important parts to the team. I will be working on it, and I also have other medical providers and nurse practitioners who are family practice trained. We all are working in addiction medicine and can provide resources, whether that is people who want referral to inpatient programs, whether that's as simple as naloxone training for a patient or their family and loved ones, whether that is medication for opioid use disorder, or even just some of the underlying conditions, which are maybe mental health disorders, that anxiety, depression, schizophrenia, something that hasn't been treated well that people have been self-medicating for. We're able to provide all those for our medical team. Additionally, we so importantly have our peer recovery support staff that will be there that can help those people, again, and their families be able to understand peer services, be able to talk to them from a perspective of lived experience. We'll also have our medical staff that will be our medical assistants or nurses and be able to connect them with mental health providers that are either on the bus, on the RV or mobile health unit with this, or be able to connect them to telemedicine services that we can use on another portion of the mobile health unit.
Truly a multifaceted unit that can be service Arkansans in a number of ways.
Yes. So a lot of people have asked us, what does it mean, mobile health unit? And we purposefully had it designed where we could literally take our clinic and replicate it in any area of the state that is needed. And so it has fully functional staff that's there, and also has a lab that's on board, be able to connect people with services that they may not be able to have any or a portion of that in their community. So we can help to bridge those gaps in our communities.
And so when you say bridging gaps in those communities, how does it get to the communities? Is there a request service? How do you determine where it's going to go?
So we really have been listening for the last couple of years and seeing where some of those greatest areas of needs are. And we know that there's the different corners of the state, right? That we know that there's a lack of resources due to staffing shortages. Maybe it's just the mileage that it takes for somebody to reach substance use services. We know that in the rural areas that it is at least 40 miles for people to travel to be able to reach specialty services like addiction medicine. And so because of that, it puts a great strain on people due to some of those access and barriers to care. We want people to go to our website, armobilerecovery.org, and they can submit to be on a mailing list or be able to ask for assistance in their areas. And we also ask people to reach out to us. And while we do have some areas that we know are in great need that we are setting up to be our regular sites, and we want to hear from everybody on how they might know of a need or want to create a partnership within their community, because this is about us really building connections, serving people over a period of time, and being able to get some really practical solutions to some of the complex healthcare needs that we've seen.
And you say building community relationships. Can that be churches, civic groups? I mean, what do you mean, and what do you want the general public to know?
Yes, and I would say that means anybody who needs help, right? But certainly we've had churches that are organizing with us, that are having us come to some of their events, that they may have regular dinners or outreach to the community. Homeless coalitions who had difficulty finding providers that would provide services in those areas of need. There are some communities that simply don't have a physician or a provider that's nearby. We have certain counties that actually do not have a doctor that lives in their county. So we're coordinating with health departments, some of the recovery communities that may have sober living houses or recovery housing, but they don't have medical providers that are willing or able to provide that care. So any of those different organizations, and we have law enforcement areas that are concerned about a high rate of opioid overdose, that they're wanting some naloxone training. And we have naloxone that we can not only train people with, but we can provide for free for those people in need.
And you say free, that you do not have to have insurance. Anybody can come, knock on the door, and be seen.
Anybody can come and knock on the door and be seen. Our naloxone we will provide for free as long as we continue to have supplies of it, right? We do obviously want the organization to be able to, the nonprofit, to be able to continue to provide services to anybody that's in need. So while we have take insurances of all kinds, all the major insurances that we'll be able to provide that through, we also have grant that's available, particularly for those people with opioid use disorder and stimulant use disorder, that can receive services for medical, mental health, and can receive appropriate prescriptions that would involve treating their opioid use or stimulant use disorder.
And do they apply for those grants once they're being seen there in the unit?
Yes, they would be able to apply for that or call us ahead of time to determine their eligibility. And I think the other important thing that we do as a group that I particularly love what the peer recovery support specialists can do, and that is if somebody comes in and is uninsured and they need connection with insurance resources, they can help connect them with that. They can help them apply for something so that over the long term, they have those continued access to care and medications because somebody has helped them with sometimes what is a tedious and overwhelming process for some patients to do out in rural areas.
And you mentioned this at the beginning, that this is a part of the Arkansas Mobile Opioid Recovery Program.
Yes.
So is that just the truck, or is it there a bigger picture that you want the healthcare community to know?
Well, I think it's starting with a mobile unit, right? Really our goal that I've been talking about for the last couple of years, or my vision, is that we have mobile health units that run out to all areas of the state, that we service those areas that are in need. And if that's one unit that's going around the county all the time because the need is that great, then so be it. But really trying to reach those corners and areas of the state. And one unit cannot do that. So we're hoping, and I'll say cautiously optimistic about a second unit. But ultimately our goal is to be able to find opportunities, funding or partnerships where we can provide these services so that no longer will people have to feel isolated, alone, or have to suffer in their addiction because they're just nowhere close to care.
So there are opportunities for partnerships for healthcare providers. What does that mean?
So I think one of the important things that I envision for this, and we've heard the call from the communities, is that there are a lot of medical providers that would be interested in maybe starting a program at their own clinic, or just want the education on how to serve better the population that suffers from drug addiction. That can be a little ominous and overwhelming, not knowing what that model looks like. And so we actually have had people come to the clinic to see what it looks like to integrate addiction medicine care into a regular primary care clinic. And we really want to be able to go out into the communities as well, where if providers are interested in finding out, and that could be a medical provider, that could be a mental health provider, that could be somebody else in the community that's interested in seeing what that looks like and how they might start that, or just learn part of that process so that they can implement that into their own. Might be somebody that just says, I want to donate some time as a medical provider and spend a few hours helping to work in this area of medicine in my community, where they can come out and volunteer. We look forward to those opportunities for people to volunteer or integrate into this kind of education and training.
Consistency and trust are so important when seeing a physician. Tell me about that and what is the intentionality side of it for you guys and what you're doing at that unit.
Sure. So in talking about our schedule and the areas that we go to, one of the important things that we do evaluate is being able to go to areas not just for a day, but to build those relationships over time so that we can provide consistency for those patients. Too many times they've been let down or disappointed that they didn't have continued services. And for their long-term outcomes, it's really important that they can believe in that and they can develop those relationships, because once we develop consistency and they can begin to trust our team and their process, then we start to really get some great results. But until we have that, it's really hard sometimes to get down to the inner issues that people need to be able to address.
Well, Dr. Martin, thank you. Thank you for sharing this information, and I hope that you are overjoyed with requests to have your mobile unit come to different parts of the state. But thank you for the things that you do for Arkansans. Thank you.
Thank you, Robin. I appreciate it.
And that's it for this episode of AFMC TV. Have a great day. Thanks for watching.